Hey guys, thanks for tuning in. A couple weeks ago, Jess was in the office and we were talking a little bit, and she noticed a flyer for some of the different therapies that we do. And so we started talking about it, and really the reason we have these therapies in the office is so that the patients that we see a lot of times are at a different side of their health. They're going to be in a place where they're almost more at a fork in the road, where they have to either start to regenerate and replenish cells and cell systems in the body and nerve tissue and things of that nature, or they're going to watch their quality of life go downhill pretty quickly. And so we have the things in place for that, but these same therapies are phenomenal for the athlete, really for anybody, because they all have to do with healing and regeneration. I always encourage that you help heal and treat your body when you have more tissue rather than waiting until things break down. But, that just so happens to be when we tend to see people make their health a priority is when they're having some pretty major problems. But really looking at some of the different therapies, I guess I'll start by mentioning what they are, is going to be some of your different IV therapies. So you have different things like IV hydration. Huge one for your athlete is going to be glutathione, which is a major antioxidant that helps the system. We have things like vitamin bags, even things that will help the brain function better. We do have platelet therapy, so PRP you've probably heard of, and then there's also A2M, which is another form like that. And then lastly, we have HRT, which is hormone replacement therapy, or just really making sure that your hormones are at a level so that your body can heal the way that it should. So the way my talks are always set up is I like to give an overview. If this is something that you say, okay, well, I know what the therapies are, and you want to move forward, go ahead and give us a call, or you're welcome to shoot me a message or ask questions. If you want to know more about more of the why behind these things, that's what I'm going to get into with the remainder of the video. And then if you guys did want, we can certainly set up a weekend where I come in and do a question answer for some of the more detailed questions, things of that nature. So all in all, the therapies, one thing I will mention is that if you want to come in just for these therapies, you certainly can. You can come in for a head-to-toe neurological evaluation to see if there's any pre-existing type stuff, but you don't have to do the full exam. You can come in, talk to our PA. She'll ask you some questions or help put your heads together, see what you want from some of the things that I mentioned, and then we'll do a brief information there and get you going on some of the therapies. So we could do these direct more so. So what I'm going to do is I'm going to go ahead and start with glutathione. And so what glutathione is, it's a powerful antioxidant. It's probably one of the most studied as far as its ability to buffer what are called free radicals. So when you exercise, your body, as a byproduct of energy metabolism, your body will release free radicals into the system, and those are basically unstable molecules that things they come in contact with, they really start to damage. So when free radical and oxidative stress goes up, you could think inflammation also goes up, and so this is not good on the system. And so yes, your system does have some ability to buffer these things out on its own, but as we age, those systems become less efficient, and that's where we would look at things like a glutathione, either taking supplements, which glutathione taken as a supplement is not very effective because there's a lot of even research out there of how it's not absorbed the same way taking it through a pill. But I would actually recommend taking N-acetylcysteine, which is NAC. That's going to be digested, and it gives your body the building blocks to make its own glutathione. But IV push is even a more effective way. It bypasses that whole digestive tract, goes right into your bloodstream, and gives your body what it needs. So Looking at any free radical production, we're going to see damage. A lot of this research was done with ultra marathoners or marathoners, people really pushing their body, where training is probably higher than, and I understand it's a hobby, it's a way to manage stress, maybe things like that, but too much of a good thing tends to not be a good thing. And so you'll see where marathon runners have had connective tissue problems, joint problems, cardiovascular, and a big problem with free radicals and inflammation. Something that's particularly vulnerable is going to be nerve tissue. And so that's what we look at, helping people with more of a cognitive decline, brain rehabilitation, neuropathy, some of these different conditions, really making sure they have the proper building blocks and the proper buffer system. And that's really where glutathione comes in. So I don't want to scare people away from exercise. I've done CrossFit for years myself. I like to get out and run. Just having a strategy in place to be able to manage any inflammation that builds up is key. And so I like to look at your overall stress level, because stress will use some of this stuff up, your inflammation level. And if we look at a little background information here, is going to be something that the World Health Organization and some other groups do on really looking at what's called the burden of disease. And you can Google any of this stuff. Burden of disease is going to be the different conditions in healthcare or in the community of the population that rob a person of their quality of life, that cost the most amount of money to treat, and it's just really, they have some pretty horrible type of outcomes as far as what a person will go through. And so we look at these top conditions, and the top conditions are going to be heart disease, cancer, diabetes, dementia is up there, cognitive decline, things of that nature. And there is one thing that they all have in common. And if you look at what that is, that's going to be high inflammation, chronic inflammation. So we really want to make sure we buffer that. And so if exercise drives that up, make sure you have the strategies. So a healthy diet, rest, and recovery days where you just take a day off. And that's going to be really important to do that. I have the Garmin device here looking at heart rate variability, the Whoop, the Oura Ring, the Apple Watch. All these guys have similar technology, and it just tells you if your body's in a place to train or not, or just make sure you program yourself some rest and recovery days. Drink a lot of water, things like that are highly important. Some of the benefits of exercise, because I want to actually encourage that, are going to be some things like you will build your immune system. Some of these detoxification systems will actually get stronger in your body. So I like to encourage that, but your body does stop producing as much glutathione. So if you can help support that, that's really where I would encourage a approach like that. But also pretty exciting for the brain and for other tissue in the body is there's something called neuroplasticity, which looks at being able to regenerate your own nerve cells with the proper cellular environment and proper stimulation. And looking at encouraging neuroplasticity, there's something called brain-derived neurotrophic factor. And so with this brain-derived neurotrophic factor, it's actually on one of your genes, and it's a signaling protein that tells your body to rebuild and heal nerve tissue. And so the way that you trigger and activate this gene to signal, this signaling protein, is through bursts of intense exercise. So HIIT type training, high intensity interval training, which is exactly what we do with CrossFit. And so lots of benefits, obviously, to exercise, but once again, too much of a good thing is not a good thing. Glutathione does a great job of actually taking some of those byproducts and neutralizing. A couple other great things it does is it is a huge immune system regulator. So what it will do is you have these cells called T regulatory cells, and they are very influential in the expression of autoimmunity. And so if people are developing an autoimmune type condition, or they have it and it's starting to turn on, these can actually manage the turning on and turning off. They have glutathione receptors on the outside of the cell, and as long as your body's not using it all up on other inflammatory conditions, like chronic inflammation from what you eat, or stress can start to wipe down some of these systems. Too much exercise without recovery is rough. A bad diet is rough. Then you don't have the glutathione to help regulate some of those different T regulatory cells and things like that. Also, one of the more important organs in your body is your liver. That helps you detoxify and filter your blood. When you're filtering your blood, you have something called phase 2 detoxification, and that's where you convert things from fat soluble to water soluble. In that process, glutathione actually helps to boost the efficiency of that system, and so having that available for your body to be able to help with that is huge on overall health. I can't say enough about it. It's probably one of the most important things that I could think of as far as how it relates to athletes and making sure that you really stack the cards in your favor for proper healing. I did an IV push of this yesterday, and it's something you can do on a periodic basis just to make sure your body's one step ahead on its healing. Next, let's go ahead and talk about a couple of the other different pushes and IV bags. So this one's pretty important here. This is going to be IV hydration. So this is a hydration bag. You get set up to an IV. You hear about hydration bars and things like that. Sometimes people use that for hangover, things of that nature. We're not trying to promote it for that as much, obviously, but what I look at is summertime training, and you'll get especially when it starts to get really hot, right around Murph and after, from basically Memorial Day to Labor Day, we really push a lot of our fluids out of our body. So drinking a lot of water, hydrating earlier in the day or days before is really the necessary approach, but IV hydration can even be more effective. So we can add B complex to this, but really pushing up hydration is a great preventative strategy so that you don't obviously become dehydrated. You see different types of conditions like rhabdo and things like that aren't directly related to hydration, but if your body's in a hydrated state and you're really maxing it out, there's more of a likelihood for things that are a bit less desirable. Obviously, muscle strains, muscle pulls, cramps, things of that nature. Next, this is called a Myers cocktail or a Myers bag. This was developed by Dr. John Myers many, many years ago, 1960s. And what this is it's an IV infusion. It uses different things: magnesium, B12, B complex, vitamin C, calcium, and it's pushed into the bloodstream so that you're really dosing yourself with nutrients. Once again, the level of quality of different vitamins, the amount that they're created to where they actually get absorbed when you take them can be limited into some levels. So having an IV push is going to be a much better way to ensure that your bloodstream gets everything that you need, your cells have what they need to properly heal, and for your system to be able to recover as it needs. Big one here for some of the people that we work with neuropathy, sciatica, different nerve tissue, cognitive function, overall energy is going to be B12 injections or B12 IV. So we can actually put this in with some of the different bags. But once again, keeping your body's energy up, really having it to where your liver has what it needs, and really helps to regulate appetite. Some of the different benefits are going to be mood, sleep, having your proper B vitamins regulated. And once again, things like stress, things like dehydration can impact all of that. So being able to have an ability to have a push of more B vitamin is a great thing here. NAD, this is a coenzyme that's found in all living cells in the nervous system. This one's particularly important for people with brain fog. We hear a lot about the long COVID, a lot of that. So when we look at people who are experiencing brain fog, there's going to be a couple different things. So your frontal cortex in your brain actually has to process a lot of information. That's where our executive function resides. So that's being able to make a decision, emotional control, things like that. And so what we look at is when we have a lot of inflammation in the brain, we'll start to see people have a problem with the first three things are going to be focus, attention, concentration. The things that you used to be able to do, you can't, your endurance seems to go down. The amount of time you can read something, the amount of time that you can focus or concentrate on a topic, that'll go down. And then as that impact lasts for longer and longer, that's when we start to see depression, anxiety, and insomnia. So, you have a day where you haven't slept enough, or, you have a lot of stress going on. That's probably something you would expect to see. Now, if we really look at tying that back to chronic inflammation, especially that will build up around in the brain tissue, when we start to see that on a daily basis. You walk into a room and you can't remember why you went in there, and that happens multiple times a day, or you pick up your phone and you're like, what was I going in here to do again? That's really the early signs that your brain is not functioning as well as it should. Really, a couple of the other things, the NAD, the B vitamins, those are very beneficial. The glutathione, but the NAD can be very impactful there too. So I figured I'd talk about that one because that's another one that we have. And then for the summertime bathing suit season, this one may be a little bit of something that people want to know about, but this is called the skinny shot. So basically what this does is it helps with elimination of fat and toxins. Toxins are trapped in your fat, but it really helps the liver function better, break down certain different toxins in the body. It does contain a number of antioxidants, and they will actually help to improve collagen, things of that nature, and also helps to support sugar levels and reduce sweet cravings. So skinny shot, in addition to what you're doing, is a great strategy to help just kind of in that whole snowball. I don't ever try to rely on one thing as a solution. I don't try to say, okay, well, I'm going to do this one thing. Everybody wants the lock and key. So the success is to have a lock and have a key, and you put that one thing in and turn it. The human body, unfortunately, is not that simple. It is more like a combination lock. So there is a series of things you have to do, and everybody's combination is different. But skinny shot and some of the different therapies are huge there. This one here, this is platelet therapy. So you guys have probably heard of platelets for different joint type of damage. And we can definitely do some of the platelets into a joint, shoulder, a knee, things of that nature. We've been doing platelets for years. We've been doing stem cells up until the FDA actually stopped stem cells from being able to be done. So we can't do those anymore. But platelets are very, very effective. They actually help you to, they use your own cellular tissue to help you to heal some of your own injured tissue in your body. And we can do that into the joint, but we can also do what's called an IV push, where the platelets circulate around your body. They actually seek out damaged tissue. And so if it's blood vessels, if it's other cells in the body or tissue in the body, your platelets will actually go to work helping heal with that. So figured I would talk about that guy there. And then we have A2M, that stands for alpha-2 macroglobulin. Not as important that you know that, but this is another one. This one is more so for your joint tissue itself. So we see people with maybe a partially torn meniscus, things like that, shoulder injuries, a tear in, say, a partial tear in a muscle, like a rotator cuff is a big one. And this is a very good regenerative therapy that helps to go in. It really helps to block some of the pain, but it's a great angle with biology to help get your own system to heal much faster. You hear about athletes tearing a hamstring or tearing a tissue. They're going to go in for platelet therapy. It's really going to help speed up and ensure that the tissue becomes better healed than you will without any of that type of therapy. Last thing I'll talk about is going to be more of the hormone replacement therapy, so HRT. And with this, I was never really sure of my stance on this. I was kind of like, okay, well, I don't want to interfere with my body's own production. And looking at it now that I've gone through it, it was actually kind of interesting how the information overlapped for me. So I was going through and I just completed my 150-hour postdoctorate functional neurology fellowship program. And while I was going through that, the doctors there, very, very high level, high educated individuals. One of them is an instructor at Harvard School of Medicine. The other guy basically went to Duke and did a lot with them in their School of Medicine there. And what they're looking at is your body having everything, all the substrates that it needs to heal tissue properly, to heal your body. And I'm not talking about abusing testosterone or any of your other different types of hormones so that you can build a big jack body. This is about going in, getting a blood draw, seeing where your levels are, and if you're crashed way down below where you should be to heal, I mean, you could take a type of an approach like, oh, well, I'm going to tough it out and deal with it. And that's kind of where I was at. And I ended up getting mine taken, and mine weren't extremely low, but they were lower than what's called optimal level to actually be able to heal. So basically what we do is we take your blood work and we put you into a range that's more for healing. You're probably not going to notice a big time bodybuilding type of an effect with this, but it's looking at things like brain tissue, nerve tissue, liver, that you have those sterols is what they're called, that you're using your cholesterols properly to be able to actually heal and build tissue from that way. So we have a whole lot more information. We have our PA and some of our medical group that has worked with that, but I definitely understand the basis. Another big one is going to be thyroid hormone. So there's people who are hypothyroid. Thyroid is going to be one of those tissues in the body that's really attacked by autoimmunity, which we see a whole lot more of than what people are not led to believe, but made aware of, I guess. And so really there's thyroid receptors on every cell in your body. It's not just your thyroid gland and that's it. Every single cell in your body has thyroid receptors. So your thyroid gland is basically the metabolism powerhouse. So one of the old sayings is, when my get up and go has got up and left, that's when you probably have metabolism or thyroid issues. And once again, if your body's trying to regenerate, build its cellular processes properly, and you don't have those substrates, all you're doing is slowing your body's ability to rebuild. And I always explain it like building a brick wall. If you're trying to build a wall, but you don't have bricks, you're stuck sitting there saying, okay, well, I'm slapping some mortar down, but nothing to actually construct the wall. So once again, we're not talking about hormone abuse. We're talking about having the substrates. I do always like to be able to provide, and I always want to be able to bring you guys evidence. Here's a couple papers. These are from different medical schools here in the United States. And so this guy here is going to look at the effects of testosterone on cognitive and brain aging in elderly men. So you can actually see how lack of testosterone will start to lead or can affect somebody's ability to rebuild cells in the brain. Here's another one. Testosterone reduces neuronal secretion of beta amyloid peptides, which is one of the main things in Alzheimer's disease. So this article goes through quite a bit of an explanation of some of the impacts of how low testosterone can actually impact your ability to heal the tissue as you're trying to build neurons, things of that nature. So once again, listening to some of the doctors, all that stuff lining up as I was doing the fellowship program, they were covering the same information at that time. So I was just like, wow, what good reinforcement that this is necessary, and then provided tons of these papers. I've got hundreds and hundreds of peer review research or articles, and that's important to me. I don't want to just say it because somebody said it. I can actually get information for you guys if you need. Last one here, the role of some of your different pituitary gonadal hormones in the functioning of the brain, essentially, is what this talks about. And so there is, like I said, it's a lot of research behind this. If you want more information, I'm happy to provide that. But I guess a recap, make sure that your body has some of the proper substrates so that you can heal properly. Exercise is great. I love exercise. It will help push your body, but you really want to make sure that you have an ability to recover and heal. So take rest days. Don't burn the candle at both ends. Great device is going to be your device to be able to chart for your heart rate variability. Make sure you get plenty of sleep, plenty of water, your nutrients are up, your diet's good, inflammation is down, and I think that's a good little introduction. Once again, feel free to come up and introduce yourself or ask me any questions. If you guys, I will go ahead and put out a few more detailed if there's enough requests for that, and then if you guys did want me to come up to the gym and do a health talk to be able to answer any Q&As, at least questions and answers, I'm happy to do that. So I hope everybody's doing well with their training, and I hope everybody continues to do well, and let me know if I can help in any way. All right, thanks guys.